I do think that with being able to curb your appetite some, then you can make better decisions. So if you know already that you're a person that's highly cavity prone, then and you like sugar, and if this can stop you from eating so much sugar, or just give you, okay, I'm going to eat this piece of candy, and then I'm going to go brush my teeth, like just to make better choices.
Absolutely.
Overall, I think it does a really good job with that by helping with that, the cravings, like you were saying. Getting there, so people like you talked about, heart doctors, cardiovascular doctors sending people to you. The medicine that they put these patients on for strokes, heart disease, diabetes, all those, a lot of things, wreak havoc in their mouth. They're either getting a bunch of ulcers, they're dry mouth, they're full of, their gums are just like overgrowing, just like a whole gingivitis, and all that then will harbor bacteria because you can't clean it. Right. It's just this vicious circle. So if they could get off that medicine, that would be great. And I tell them, oh, we have this issue in your mouth, and they're like, oh, how can I fix it? I'm like, well, get off the medicine, but it's your heart medicine, so no, don't get off the medicine. We're just going to have to maintain where you are with your oral cavity, right, so we can keep your heart going, because it's more important.
And what we see with people on GLP-1s is a high majority of them are able to either reduce or get off completely high blood pressure medicine and cholesterol medicine.
That would be great. Yes, because those are not good for the mouth, for sure. The other one would be the weight loss, and I feel like that's a big one. I mean, most people, I guess, are probably taking it for weight loss, I would say.
The majority, probably.
Yeah, more than likely, probably, possibly, for sure. So a very small percentage is coming from the cardiologist, probably. But they have the advantage of losing weight, which also, once you lose weight, I feel like, I would hope, people are more apt to exercise, move around.
Well, it's easier for them, for sure.
And easier to move.
And,
yes,
one of the ones that we see a lot of are the orthos. Orthos send people to us because it's bad. Extra weight is bad on their joints, bad on their muscles. So they come in, if you can drop 20, 30, 40 pounds, you walk so much better. Your back feels so much better.
Yeah. Right. And then they'll want to get up and move around, even just moving around their house. Absolutely. Compared to like just sitting down. And it's so much better for everything, your overall health in general, So I think we're too stagnant. We have the Alzheimer's and dementia risk is really bad, the cancer, all those things. If our body doesn't do what it's supposed to do, if it doesn't move properly, eat the right stuff, and we don't all do it all right all the time, but
it all goes hand in hand.
It's all connected, definitely all connected. And then for the mouth, there's also all this inflammation. So the cancer cells get inflamed, they start proliferating, so then they form a cancer. They become a cancer with our cancer cells we already have. Then the Alzheimer's or dementia, they've actually found the plaque that's in the mouth is in the brain. So they can take the dementia patient, of course they don't take it out when they're alive, a deceased dementia patient, the plaque that's there that they know they had dementia or they had Alzheimer's, and they test it compared to the mouth bacteria, it's the same bacteria. Right. So we know that that's all related. And if we can decrease the inflammation, which is swelling everything, which is for all these issues, we could decrease a lot of these causes, even the mouth stuff.
And, one of the other things that it does, I'm sure I'm stealing your thunder for the next item, but
go for it.
It also helps reduce the acidicness of the stomach lining. One of the things that it does is it slows the digestive system down, where your food stays in your stomach for a longer period of time. You don't have that reflux. So as it battles that, you're less likely to have either gum disease or decaying teeth because of acid coming up.
Acid, yeah. And then, we all drink acid too, with colas or energy drinks too. A lot of people drink any carbonated drink, is acidic. So, and even just juices, can be acidic. So those two add to, if you have acid coming up, acid going in, it's all passing the teeth. And that erosion is big. Over years and years that you see that you're doing it, you get some erosion. So it's nice to hear that it does decrease that. A lot of people really suffer with all of that, and it's, so that's a huge benefit. I don't think the medicine you take for that's very good for you either. So it's much better, like everything, it's better to get off of it and not have to take the medication for it, even over the counter stuff, compared to, taking what you need to take and hanging out like that for a long time in your life, But the price is always a problem, I think, for some people. So I'm excited to hear about the other options. Some of the negative effects, too, I was going to talk to you about GLP-1 is the dry mouth, though. So we had the positive effects of how it helps with the oral cavity with dentistry. The few negative effects, I think that I can you and I can, between the new company that we think we're starting with the Making Wellness, combat some of these problems. So there's dry mouth, we know that's a lot of medication though. It's not just the GLP-1, right, but the heart medicine, all those do the same thing. And I feel like we could increase this saliva production with using one of the packets that they have in there. We'll talk about that. Decaying teeth also, when you have the low saliva production, and that's the same thing we just talked about. You just don't have it to wash off, so you have the acid that's in there, and the dry mouth, bad breath, all that. And then the gum disease, so when everything's swollen, like we said before, stuff goes in there, then you get the gum disease. So all these things kind of happen also because of GLP-1. So even though we said there was a lot of good for it, there is a few things that it can cause.
Absolutely.
The biggest one probably too that I thought about was muscle loss. So that's a big one that everybody talks about, is that the GLP-1 is supposedly eating our muscle instead of eating the fat in the right spots. You want to tell me about that?
Sure, it can. So, one of the things that we talk to all our patients about is eating protein. Protein is what's going to protect your muscle when you're on a GLP-1. So by eating protein, might cause some other things in the mouth, but it definitely does protect muscle. And then just talking about other peptides, there are some other peptides out there that also protect your muscle, like glycine. Glycine's a muscle builder. And, if you look at some of the trainers, I know your son's a trainer,
yep,
well known here in Baton Rouge.
Yes.
So if you talk to the trainers, they do Summarilyn or even some small doses of testosterone and different things. So that also helps build muscle.
Yeah, creatine. I love creatine.
Absolutely.
And I'm laughing about the protein because I get fussed at all the time about the protein. I'm just not huge. And I go in waves, but I'm just right now not a big protein person.
Yeah, it's hard. It's hard to eat just protein, but that is truly what builds and protects muscle.
Yeah, so. It feeds itself. So, I do Botox and filler at the office. And so I was thinking, like, wow, we start losing weight and you start seeing these people and that they've lost weight, which is great, right, but we also lose weight in our face. So it's kind of everything starts to sag. We've got a buccal fat pad, you got collagen everywhere. And so once that all goes too, we can help treat it with some Botox. We can tighten up the muscle. Filler, we can kind of fill back in some of the spots for those. So we even the muscle loss, we have combat for facially wise and all systemic. So I think that is a great way to talk about our new partnership with the new company, which is Make Wellness.
Yes.
Which is very new, just started in March, right? Just launched in March.
Just a few months old.
So very a baby new company, which has some great options for us to aid with the GLP-1s and the peptides that we're talking about, but then also for people who can't afford those peptides, people who don't want to take a peptide, don't want to do an injection. There's so many people that are I want to say. Some people love where we are, but then some people don't.